This is part two of just the tip and the pullback. People ask me what happens if the pullback doesn't work the first time. Here in these little videos, I'm demonstrating what I do because it's going to happen sometimes, but it's not a big deal, and you'll see why. Here I just use the tip to do the dissection, just the tip of the cone. I'm going to cauterize. I get my visual cue with the spray that it's working. I'm getting a seal. I'm staying right in the same spot as I do this. I do the pullback and it didn't cut, which happens once in a while, less and less as I do this technique more. I do a little bit of a twist here, and then that's all it takes. So I'm calling this the sort of the touch-up. If it doesn't work the first time, here you can see I cauterized it and sealed it. It didn't cut. I went back, went a little more distal towards the body side, and then cut it and pushed through. So the best thing about this is the branch always stays in front of you. If you don't cut it the first time, it's right there. You can see it. It's still attached. Even if there's bleeding, you can just cauterize the bleeding. And here's a branch that I cauterized, and I do the pullback, and it doesn't completely cut, but it was sealed, so I just pushed through with the tip. So you're either going to do a little twist if it doesn't cut the first time, do a second pullback. If it's sealed and it's just adventitious, just take the tip of the cone and push through the adventitia and you're done. Again, the reason I started doing this is because users were saying they couldn't see the branch when it cut. With this technique, you do see the branch when it cuts. And if it doesn't cut the first time, it's still in view. And here I seal it, I cut it, and I just push through with the tip. Here's a large branch. I just do the tip dissection, one pass underneath, one pass above it. I sneak in, and this is a really large branch. And you can see it sealing as I move forward. Right before I do the pullback, I think I have a good seal, and I check it, and there's just a little bit of tissue still attached. I have a good seal. It's not bleeding, but it's right in front of me. So I go back to exactly the same spot and just do a little bit of a cautery there. And I advance just a tiny bit with a twist, and it cuts right in front of my screen. So the touch-up is not hard to do, and it's continuing to keep the branch in view for your cautery, seal, and cut. So here I have a tough branch. It's right at the trocar. I'm going to cauterize it. I get my visual cue with the spray. I move towards the crux, and then I do my pullback, and there's still some adventitia on here. So I go back and just cauterize it again. It stays in view, and now I'm just going to do a little twist and cut to take care of that adventitia. Here's a couple bonus clips. Mike in Arkansas came up to watch a case, and he mentioned this is what he likes to do. This adds maybe an inch, sometimes more vein, because you don't clamp it as far up the leg. And after I cut it, now if you want a dry extraction, you put a large clip on it, let it fall back into the leg. This way the vein doesn't bleed while you're taking it out, and your tunnel stays dry. So I just grabbed the clip that I put on the end of the vein and pulled that out of the tunnel.